Hello, my name is Stephanie and this is Vanessa here. I'm recording this video as part of the head to toe assessment for nursing skills class at Nightingale College. Vanessa, do you understand and consent to participate in this skills video? You will be recorded. It will be used for educational purposes internally for grading, and it will be reviewed by faculty.
Yes.
All right, thank you so much for that. So Vanessa here is being seen post right ovarian cyst removal, and I will enter my patient's room, close the door behind me to ensure patient privacy. I will perform hand hygiene, and I will apply clean gloves. Hi, my name is Stephanie and I will be your nurse today. Can you please verify your first name, last name, and date of birth for me?
Vanessa Carrera, 6/14/83.
Thank you so much for that information. So today we're going to do a head to toe assessment. Is that okay with you?
Yes.
So I'd like to start with the patient's overall status and general information. Can you please tell me what city we're in?
Winnetka,
And what time is it?
10 p.m.
And what procedure did you have yesterday?
Ovarian cyst.
Are you in any pain?
No.
Do you have pain in the surgical site?
No.
All right, so the patient is alert and oriented to person, place, the time, and the situation. Her posture is upright, the gait is steady, and the hygiene and grooming are appropriate. The patient's speech is clear, the patient is coherent, and for background information, we'll go over the vital signs. The heart rate is normal. There are no palpitations, no irregular heartbeat. The rate and rhythm are normal. The heart rate is at 76 beats per minute. The blood pressure is 118/72, and that's within the expected range. Temperature is 98.2. The patient is a febrile, and the skin is warm and dry. For pulse ox, we're at 98% on room air. That's within normal limits. There are no signs of hypoxia, and the respiratory rate is 18 breaths per minute. Again, that's normal. And for the pain assessment, the pain score for my patient here is 0. So I'm going to observe the color of the lips, and I'm going to check for moisture. The lips are pink, they're smooth and moist with no cracking or lesions noted. Can you open your mouth for me and say ah? The teeth are clean and the gums are pink. It's free from swelling or bleeding. The mucosa is moist and pink, and the soft and hard palate are both intact. There are no lesions. I do not see any discoloration. The tongue is midline, it's pink, and it's free of ulcers. I do not see a deviation noted. The tonsils are pink without swelling. All right, so now we'll palpate the nose and assess for symmetry. The nose is midline, symmetric, and there's no tenderness, palm palpation. I will check the septum. I will check inside of the nostrils. The septum is midline, mucosal is pink. There are no signs of polyps or bleeding or discharge. I will verify the patency of the nares. Can you please cover one nostril and breathe through the other? Can you do that with the other nostril, please? All right, so the nares are patent bilaterally. The airflow is equal on both nostrils. I will now palpate the sinuses. The frontal and the maxillary sinuses here are both non-tender to palpation. I will assess my patient's hearing with a whisper test. I will whisper a number. Can you please repeat it?
20. 60.
All right, so my patient accurately repeated the whispered words bilaterally in both ears, which indicates normal hearing. Now I will take my pen light. I will look inside of both ears. And before I do that, I'm checking the external ear canal. It's clean and dry and free of redness. There is no swelling, and I will assess for ear discharge and tympanic membrane. There is no discharge present. The tympanic membranes are intact with visible light reflex. I will assess for asymmetry. With both eyes, they're aligned and symmetric, and they're moving together. There's no abnormalities observed in the eyes. I will palpate the lymph nodes next, the cervical, the supraclavicular lymph nodes, the posterior lymph nodes here. They're all non-palpable and tender and non-tender. Swelling was not noted in the lymph nodes. I will observe and palpate the trachea and the neck. The trachea is midline. There's no deviation. The neck is symmetrical with no visible masses here. The thyroid gland is not enlarged. There's no, it's not tender upon palpation. The jugular vein distension, there's no jugular vein distension observed here. So now I will check my patient's neck range of motion. Can you please shrug your shoulders for me? Good. Can you look up? Now look down. Move to your left. Move your head to your right. Side to side. So the neck demonstrates full range of motion, and I check the flexion, extension, the rotation of the neck, the lateral bending, and the range of motion is smooth without pain. The shoulder shrug is strong and it's equal bilaterally against the resistance. All this indicates that the spinal accessory nerve is intact, and again, that's the cranial nerve number 11 that's normal. So now I will auscultate both anterior and posterior both lung fields are clear bilaterally in both anterior and posterior. I did not hear wheezes, crackles, or rhonchi, or any adventitious lung sounds. Can you take a deep breath for me? Chest expansion is full and equal, and it's symmetrical with inspiration. Have you recently had a cough?
No.
So I will palpate the thorax, and it's non-tender to palpation, no masses, no abnormalities found. I will assess the breaths. Breathe normal. Breathing is normal and even. There's no use of accessory muscles. So now I will palpate the carotid and the temporal pulses bilaterally. The carotid and temporal pulses are equal. They're strong and they're regular bilaterally. +2. There's no bruit detected in the carotid artery. I will auscultate the heart sounds with the diaphragm, and then I will switch to use the belt to assess for murmurs. So S1 and S2 are present and clear. There's no murmurs, no gallops, no rubs. Upon auscultation, the heart rhythm is steady, again at a normal rate. So now I will check for pulses in the upper and lower peripherals. The radial here, the pulse, that's the inner wrists. The femoral. The posterior tibial, that's the inner part of the ankle. And the dorsalis pedis pulses here above the foot. So all four pulses are equal bilaterally, +2. The extremities are warm with no edema noted. I will check for capillary refill in the finger and toenails. The capillary refill is brisk, less than 2 seconds, indicating adequate perfusion in the peripherals. I will inspect the abdomen. In a real world setting, I would ask my patient to lift their shirt up, but for the sake of the video, I won't do that. I will inspect the abdomen. It's flat, it's symmetrical, there's no visible distension, it's free of bruising or lesions. The scar is noted on the right side, which is consistent with the ovarian cyst removal. The skin is intact, there's no bulges noted. Now I will listen to the 4 quadrants of the abdomen for bowel sounds with my stethoscope here. The bowel sounds are present in all 4 quadrants, and they're approximately about 5 to 15 seconds. There's no hyperactivity, no hypoactive activity. There's no absent areas that were noted. Now I will palpate the 4 quadrants for pain and tenderness. So the abdomen is soft and non-tender on deep palpation in all the quadrants. There were no masses noted. Do you have any bowel or vomiting issues, constipation, urinary infrequency issue?
No.
All right, sounds good. And when was your last bowel movement?
Today.
All right, sounds good. So the patient reports the last bowel movement occurred recently. And for the next step, I'm going to assess for range and motion of dress. And can you extend your arms for me? Pull your arms up, and then can you please raise them down? Now lift your arms towards me, towards you, and now push out, push in. Okay. So now can you please lift your legs? And now can you please push your legs up, push down for me? So the patient has demonstrated full range of motion in all the joints, including the shoulders, the wrist, the arms, the ankles. The movements are smart, they're coordinated, and there's no pain. At a 5/5 bilaterally in all upper and lower extremities, I assessed the range of motion. And as I was doing that, I looked for redness and edema, any bruising, everything is normal. Can you squeeze my fingers? All right, the grip strength is strong, it's equal, the gait is steady, my patient is balanced. So now I will apply a sharp and dull stimulant on the peripherals. The patient correctly distinguished between sharp and dull sensation. Both sensations are intact and equal bilaterally, and this indicates that sensation is equal bilaterally in both peripherals. And so I check the pulses, pedal pulses, +2. And do you have any joint pain?
No.
All right, so my patient denies any pain, swelling, or discomfort in her joints. There's no redness or wounds detected. My patient is alert and oriented, ×3 to person, the place and the time. Her speech is clear. There's no confusion or memory deficits that were noted. Can you please stand up, take a few steps forward, and then you can have a seat. Thank you, and you can have a seat. So the gait is steady, there's balance, my patient is well coordinated, and the patient walk with a smooth and appropriate posture. The client does not use an assistive device to ambulate. So next we're going to perform the finger to nose test. Can you please touch my finger and then touch your nose? Touch my finger, touch your nose. Again. Alright, so this was performed smoothly. The patient rapidly did the range of motion, and this completed without any difficulty. Now I will check the GCS score, and that was 15 out of 15 for eye opening, verbal response, and motor response. So 15 out of 15 on that. I will check for skin trigger by pinching the skin. So for my patient, the trigger is brisk because the skin returned to normal in the forearm quickly, which determines there's no dehydration, there's no lesions, there's no bruising, there's no redness in the skin. I checked the bony prominences here, the elbows for skin breakdown. The bony prominences include the elbows and the heels. Everything's intact with no blanching, no redness. There are no pressure ulcers that were noted either. I'll grab my patient's hand and look at her nails. They appear pink, smooth, no clubbing, no cracking, no ridges. I will squeeze the fingers, and the capillary refill is under 2 seconds. I will also check for thinning hair, and there's no thinning of the hair, no patches. Everything looks appropriate for my patient's age. So this is the end of the head to toe assessment. I will remove my gloves, perform hand hygiene, and I will provide education for post ovarian cyst removal, which includes to avoid heavy lifting, sexual intercourse, avoid 2 to 4 weeks. Please keep the incision clean and dry, and you may shower after 24 hours, and avoid getting into a pool. And call your provider if you experience a fever or severe pain, any vaginal bleeding or heavy discharge. Please follow up with your provider within 1 to 2 weeks for an incision check. Do you understand the education that I have provided you with today?
Yes.
All right, sounds good. So the patient verbalized full understanding. I will exit the patient room and go document my procedure.